Assalamu alaikum and good evening. Welcome to another episode of Health is Wealth. I am your host, Shabnam Riaz. How are you on this Saturday evening? Hoping you're having a great start to the weekend. Today, a very important program with, well, all our programs are important, but this one is of a very high importance because we're talking about TB, and this is in connection with World TB Day, which is observed on the 24th of March every year. And this year's theme is It's time. It's time for everyone to take stock. It's time for all the stakeholders to come together. So many people have been working behind the scenes for so long to combat this disease. It remains the world's deadliest infectious killer, and around about 4,500 people are, losing their lives to TB daily. So the good news here is it's both preventable and curable, and we're going to talk to our panel of experts who are here with us today about what can be done, what are the myths and the facts, and what can we do to rid not just the world, but especially Pakistan from this deadly disease. So I'm very happy to introduce our guests today, and seated next to me is Dr. Ghulam Nabi Kazi, who's a public health consultant, senior advisor for the DOPASI Foundation. Thank you very much for joining us.
Thank you very much.
And seated next to Dr. Kazi is Kinz Emaan, and she is a development project management expert. Thank you very much for joining us, Kinza.
Thank you so much for inviting us.
And last but by no means least, Dr. Khwaja Lake Ahmed, who is a national TB consultant working with the WHO. Thank you very much for joining us.
Assalamu alaikum, and thank you very much.
Starting with the program now, Dr. Kazi, tell us that, TB is a huge global concern, especially in our part of the world. Tell us about the United Nations Security Council and the high-level meeting that they had on TB.
Yes, I'm glad you brought it up. Actually, this was the first time ever in the history of the United Nations that a special session was convened in September 2018 just to deliberate on tuberculosis. And this did not come about very suddenly. It took 2 or 3 years of planning from the Stop TB Partnership, from WHO, from so many other concerned organizations. And it materialized in September last. And heads of governments, heads of states from all the 193 member states, they were there, they commented, they reiterated the commitment to TB control. His Excellency Shah Mahmood Qureshi Sahab was representing Pakistan, and he showed complete determination and commitment to stop TB and TB by the year 2030, and also provide the requisite funding for that. Because if you look at the declaration at the end of the high-level meeting, I don't want to go into the 8 pages of the declaration.
Right, but the gist of it is?
But the gist would be in 2 issues. One is enhanced access to TB services.
Absolutely.
To the entire population, regardless of any distinction or discrimination. Secondly, equitable financing for TB control at all levels, be it at the national level, the provincial level, district level, or even more peripheral levels. Because with the current pace of effort, we will not be able to even control TB, much less eliminate it by 2030. So we need to really upscale our efforts and also provide the necessary resources to address the challenges and the barriers.
Right, of course. Okay, Kinza, tell me, these were the, declarations by the UN. How is this being transferred now into implementation? How is the situation being managed?
It's been 6 months from the UNHLM now, and this particular World TB Day is of immense importance. Advocacy has started on all levels. The government is doing its steps. There are certain partner meetings happening where they're talking about multi-sectoral accountability framework, bringing like all the particular sectors in, whether be it civil society, human rights activists, TB survivors, ambassadors, celebrities, media, journalists, like instead of just efforts from one particular group, as it is like normally assumed government, it now needs to be a concrete step, a conglomerate of efforts from all partners coming on one forum and acting towards ending TB, because now we are not talking about stopping it or not talking about maybe finding a few more numbers. We are talking about ending it altogether. So the efforts are being scaled up. There is a lot of hype, but still more commitment is required from all the sectors. Like, it cannot be just one sector acting in a solo. Now we are talking about multi-sectoral accountability. We are talking about all the particular roles coming on one platform.
A collaboration with everyone providing their own expertise.
Yeah, so and accelerating efforts in the same direction, so that we can meet the commitments which His Excellency Shah Mahmood Qureshi and which our Prime Minister Mr. Emaan Khan is signatory of by the required timelines and deadlines.
Okay, Dr. Lake, tell us about, you've been a national TB consultant as well, so all the challenges, and let's talk about Pakistan specifically. What are the main challenges that we find here?
Thank you very much. Regarding TB, you see TB, the mankind has suffered from TB since centuries. And it's really a global and also a public health challenge at the country level. Pakistan, according to the global TB report published in 2018, Pakistan ranks 5th among the 30 high burden countries in the world.
That is very high.
And it's very unfortunate to see that a disease which can be diagnosed easily, for which we have very effective medicines available, more than 1.6 million people are dying from TB globally. And in Pakistan, there are 50,000 deaths from TB every year.
Okay.
So,
and these are all preventable deaths?
Yeah. So for a disease which is preventable and curable, the global community is of the opinion that nobody should die of TB.
Absolutely.
And we need to really work together. And this year's theme for the World TB Day, we commemorate on every 24 March. It's time to end TB. But that is something which needs to be done by working together.
As
TB
said,
is no longer something which needs to be taken care by the health sector. Now it's become something beyond the health sector. So the multi-sectoral, as my senior colleague Dr. Kazi has referred to, is that in order to end TB from the globe, we need to really go and adopt a multi-sectoral approach and at the same time an accountability framework, so that everybody stands accountable for the actions which needs to be taken timely to end this menace from the globe.
Right, absolutely. And as you said, this is something that needs a lot of education as well. We need, we need information to be given out to the public because when we talk about diseases and many other things that are becoming an epidemic, mainly people think that, okay, this is something that won't affect me. So how can we tell people that this is something that can, they have to be on the lookout for? What are the symptoms? What are the signs? What should a person be looking for?
That's true. And actually, okay. I'm sorry I didn't get your question right, but I know.
The symptoms and the signs.
So basically, we look for the presumptive cases. And they are usually people having cough for more than 2 to 3 weeks, persistent and not explained cough. And there's a low-grade fever in the evenings. And there may be some wasting. There could be some other symptoms, some weight loss or something. But the issue is we need not jump to conclusions. We have to investigate the person and then come to a confirmed diagnosis.
Okay.
It is not easy because the incidence in Pakistan is quite high. It's about 267 per 100,000, which adds up to about 550,000 people every year getting the disease in a population of 212 million. So that being the case, we need to do some special efforts like active case finding or actually going and looking for them. Now the issue is here that which are the most vulnerable segments?
Exactly.
It could be women, it could be children, it could be those in the marginalized populations like coal miners, it could be in migrants, it could be in IDPs, it could be in the jail inmates,
Right.
drug abusers, so substance abusers. And we really need to focus on those groups.
Right, exactly. The more vulnerable groups.
Absolutely.
So what about
Absolutely.
women as well? What are the statistics there? Do we know anything about the representation of women who are being able to come forward and being
Right
diagnosed?
now, there are almost, in the current notification patterns, there is almost 50% of the disease burden is in women.
Okay.
Especially in Khyber Pakhtunkhwa and Balochistan, the proportion of women being notified with TB is higher as compared to men. So,
Okay.
but then once we talk about women, there is a particular stigma and discrimination attached to women.
Right.
Because of which, most of the times, even after knowing the basic symptoms, as Dr. Kazi mentioned, women cannot go out and get themselves checked because of the fear that if they're diagnosed with TB, they'll
Then
be
what's going to
stigmatized.
happen?
Yes.
They're going to be sort of
Stigmatized.
isolated.
Yeah. And there have been cases where women, once they got TB, maybe when they were 18 or 20, they were not able to get married. Women who were married were literally thrown out of the houses and they're not accepted by the society, despite the fact that it's purely
Treatable.
curable.
Yeah, and curable.
It's not communicable. It's a communicable disease, but it can obviously there is a protocol for prevention. There are certain signs, which is it's easily preventable. Even then, there is a huge discrimination and a huge stigma attached to this protocol, especially when it comes to women.
Okay. So, Dr. Lig, what are the preventive measures here as well, and how can a person, if they, if they know of somebody who has TB, how can they also give them the reassurance and the confidence that they are not being stigmatized?
Colleagues were discussing about stigma. This is one issue which is a major issue, and there are myths attached to TB.
Many.
TB is an airborne infection, we know that, and it spreads through coughing, sneezing, spitting. But particularly in Pakistan context, we see that there are some things which are associated with TB, which discriminate the people suffering from TB. Like the issue of the social issue of we have seen marriages broken if someone contracts TB in the family. We have seen people losing jobs at the workplace.
Yes.
People incorrectly assume that we should not shake hands with the patient. Social isolation, people just move far away from the person. So this is like a discrimination and a hatred towards the person.
Which is actually fueling the problem itself,
Exactly.
because then fewer
Exactly.
people are coming forward because of this fear.
Actually, and just to build on what Dr. Lig is saying, essentially we are a country with a low literacy rate, particularly in rural females. So there's all the more reason to create awareness, social mobilization,
Absolutely.
and so on for these undereducated people, so that they can realize that TB is curable, and highly curable,
Yeah.
and there's no stigma as such attached to it.
So the media needs to also come forward too, doesn't it? I mean, we need this
Absolutely.
sort of an aggressive approach towards people who are living, below or slightly above the poverty
Absolutely.
line, because again, they are the people who are most at risk if they're living in, more, high populated areas.
High populated areas.
So how do we get the message across to them? I think that, giving them information in their regional languages as well would be a good idea.
Giving them information in regional language and just giving the messages out at a frequency where they can actually understand, and disseminating the basic awareness messages on a broader level, and maybe using media which is accessible to them. For example, even if we're giving something on social media, the rural population sitting in a village cannot access that.
Right.
So giving messages on mediums which are which are in their access,
Yeah.
and then giving out messages related to the basic awareness, the basic symptoms, the service availability. Like TB is free treatment is available over the country, over the board.
And exactly how many people would know that? How many people would know that they have this free, treatment? And how many people would know who's at risk?
Exactly.
Yeah.
And
So-
as Dr. Lag was mentioning, there's a lot of misconceptions, a lot of
So many
stigma,
myths.
lots of myths
Yeah.
attached to disease. So really what we need to do is educate the people properly. And
Give
that,
them confidence.
and that too has challenges because not everybody has access to national television or
True.
something like that.
True.
So we need to reach the people in any way we can. On the other hand, one-to-one dialogue is time-consuming, so we need to look for innovative methods.
Exactly. A mass message.
Yeah.
Communication. I think that television plays and serials could also be engineered around this topic.
Oh, absolutely.
Because so many people are
Absolutely.
influenced by these,
Yes,
rather than sitting and watching the usual household politics and the mother-in-law and the daughter-in-law problems. Why not have a constructive theme going on where exactly the
Absolutely.
things that you spoke about, marriages breaking up, somebody losing their job, they can be addressed in those sort of serials or plays or whatever.
These particular messages can go through the mediums of these traumas, these different television casts, through celebrities. We have recently engaged Ms. Sania Saeed and Mr. Samad Khusat as NTB ambassadors. We have taken them on board. We have recorded messages which are being disseminated to the mass media around reducing stigma, discrimination, around the basic awareness messages, and how can people access services. But again, media needs to play a higher role. We are involving journalists. We are involving human rights activists.
Right.
Now we are moving towards a human rights-based approach.
Fantastic.
We had this high-level workshop the other day in which media, journalists, celebrities, human rights ambassadors, and TB survivors, even
that's a very important.
transgender TB survivors were invited.
Okay, fantastic.
To bring everyone on board and have their opinion and have opinions of each and every cadre and the roles they can actually play in the fight against TB.
Absolutely. Dr. Lake, tell us about the WHO initiative, Find, Treat All, #NTB. Tell us something about the WHO as well.
WHO is a lead technical agency having its presence at the global, at the regional level, and Pakistan falls in the Eastern Mediterranean region and is a high burden country globally and also in the region. In the Eastern Mediterranean region, Pakistan has more than 60% burden of the TB disease in the country. And WHO, through its technical support and assistance, which is being provided to the countries, and WHO stands with the governments and support governments to address the challenge, the immense challenge of TB in the country. We have the country level presence, we have a country office at the national level, and then we have the sub-offices in the provinces as well. The team of experts working in WHO, they have dedicated their lives to in the fight against TB. There are international guidelines and the national guidelines coming for the diagnosis and treatment, the capacity building of the countries, particularly in the backdrop of this United Nations high-level meeting last year in New York, where we came up with a very ambitious political declaration. We need to really find and treat 40 million people by 2022, and we need to put 30 million people on preventive treatment.
Right.
And this is an immense challenge, but it's time to do and to go for it, because as we say, it's time to end TB, and that is possible because of all these sectors' involvement.
Right.
And my colleagues were very rightly mentioning to the role of the media. I think print and electronic media, and particularly the social media, they have done a lot for the cause of TB.
But not enough.
Not enough.
But it's not enough.
No.
I totally agree.
This has to be in really high priority. I mean, if
and ongoing all the time.
Exactly. In 2001, we declared it as a national emergency for Pakistan. We need to be talking about this much more.
And if World TB Day is on 24th March, TB is not going to go away on the 25th.
Exactly.
So we need to reinforce the messages.
A very, very important point there. While it is very important to have these days to raise the awareness, the absolute challenge that we have is to keep that, keep the burners on and keep that temperature where people are getting this message. So what about schools' involvements as well? Because children are very, very, they absorb knowledge and they love to tell you when they come home from school, even if you tell them something and it contradicts with what you're saying, they'll say, no, my teacher said this. So what are we doing at the school level?
What's happening? School health is very important. What's happening around in the advocacy and communication component is we go to various schools, give out messages, come back. The message though goes to the home, but only to the community that is being assessed by the awareness sessions being done by various organizations.
Okay.
What is required is it to be the basic communicable disease related awareness to be included in maybe science, maybe a chapter. We study so much. Why not include a particular chapter in the book which is mandatory and everybody studies it?
Very true.
Obviously that message will go to a broader spectrum and will mandatory go to the particular community at large.
True. Yes.
So though it's happening, but not happening on a level required.
Absolutely true.
Because it's so important because school children on average spend about 6 to 8 hours in the schools, or 1/3 of the whole day. And what they learn from the teachers, they usually never forget.
Exactly. And rather than focusing on adults all the time, you have to change your behavior, this, that, and the other. Why not start when they're much younger and
Yes, you're quite right, but you'd be surprised to know that even qualified medical doctors don't know how to give a correct prescription for tuberculosis. So now that's where we need to involve the undergraduate medical students. We need to involve the doctors who have registered as a doctor but not been in practice for many years. We need to have some continuing medical education also. So those are some of the things we're looking into. Actually, there's a meeting scheduled in Karachi towards the end of the month with Her Excellency the Minister of Health in Sindh.
Right.
So we're looking into how to involve medical universities in this.
That is also a very important point as well. Unfortunately, we've come to the end of the program, but before we go, I'd just like a quick message from all three of you. So Dr. Kazi first, please.
Well, basically it's time to end, but how do we do that? We need some multi-sectoral approach at the district level, preferably with the deputy commissioners as head of the steering committees, and the rest of my colleagues could.
It's a disease which was earlier thought to be just a disease of the poor, but it's a communicable disease. We need to keep in mind anyone who's breathing can contact with the disease. So we need to act at all levels and contribute to the fight against TB. It's time to end TB.
Absolutely. Dr. Ling.
I would say that we can end TB. It's possible, but every person living in the society, all the communities, it's everybody's business.
True.
If we have this motto and we have this motivation and dedication, so every person of the society and the community has to play his or her role effectively for this disease which has mankind has been suffering since centuries. We can get rid of it. And it's time to end TB.
Fantastic.
And we can do it, inshallah.
Great. So Dr. Kazi, Kinz, Dr. Lake, thank you very much for being part of today's program.
Thank you so much. Thank
you.
Okay, and with that we come to the end of today's program. So it's time for you, for myself, for everyone. As one of our guests said, that anyone who's breathing can contract this disease. It's time for us to be responsible. And with that thought, I'll leave you until next week. Stay happy, stay healthy. Bye-bye.